Let's do a quick review of HCCs and the important role of the nurse as a risk adjustment coder. So what are HCCs? HCCs, or hierarchical condition categories, are a system used primarily in healthcare to categorize patient diagnoses and predict future healthcare costs. They are particularly important in risk adjustment models for Medicare Advantage plans and other health insurance programs. Here is a brief breakdown of how it works. As you can see in this chart, there are 7 factors that determine the risk score to predict healthcare costs based on patient demographics and health status. The member's age, sex, Medicaid eligibility, Medicare eligibility due to disability, chronic conditions, disease interactions, and place of residence. Now let's briefly break each down. First, the member's age. Different age groups have varying healthcare needs and costs. Then, the member's sex. Gender can influence the prevalence of certain conditions and healthcare utilization. Then, HCCs. These are groups of related diagnoses that predict future healthcare costs. Then there's also prescription drug categories, RxHCCs. These account for the cost impact of prescription medications. Then there's the members. Medicaid status indicates if a patient is eligible for Medicaid, which can affect healthcare costs. Then next, the members. Disability status reflects if a patient has a disability, influencing their healthcare needs. Another factor is where the member resides in the community or an institution such as a long-term care facility. Additionally, there are interaction terms. These capture the combined effect of multiple conditions or factors on healthcare costs. So, what's the purpose? HCCs help in adjusting payments to health plans based on the health status and demographic characteristics of enrollees. This ensures that plans receive appropriate compensation for taking care of sicker patients who may require more resources. It is also important to know that HCCs are used in various settings, including Medicare Advantage, to adjust payments to plans based on the health status of their members; provider performance, to evaluate and compare the performance of healthcare providers; clinical documentation, to ensure accurate and comprehensive documentation of patient conditions. So, then what is the role of the nurse as a risk adjustment coder? This nurse will play a few key roles. Here are just a few. Collaboration. They often work closely with healthcare providers to improve the accuracy and completeness of clinical documentation. This collaboration helps in capturing all relevant diagnoses and ensuring that the patient's health status is accurately reflected. Reviewing medical records. Coders meticulously review patient medical records to identify all relevant diagnoses. Assigning codes. They assign specific ICD-10 codes to each diagnosis. These codes are then mapped to the appropriate HCC categories. Each HCC has a corresponding risk score that reflects the expected cost of care. And lastly, the most important role of the risk adjustment coder is training and education. Coders may also provide training and education to healthcare providers on the importance of accurate documentation and coding. By accurately coding and categorizing patient diagnoses, risk adjustment coders help ensure that healthcare providers receive appropriate compensation for the care they provide, especially for patients with complex and costly health conditions. If you are interested in learning more about how to leverage your nursing knowledge to transition to a role in health information management, download your free copy of the My Transition Journal or enroll in our transition coaching program and reach out to us today.
We want to hear from you. Schedule a free consultation or send us an email at advancednurses@acd4n.com or visit our websites www.advancednurses.info or www.acd4n.com.